If you're suffering with Peyronie's disease, then you have probably been told that there really isn't anything that could be done for you. But we do treat Peyronie's disease here with shockwave therapy, and I want to explain to you exactly the way that we kind of look at things, because a lot of people say that it's a fix for it, but I actually just want you to think about it in a bit of a different way. If this is your first time here, my name's Luke, lead practitioner at Men's Room Shockwave. We treat erectile dysfunction with shockwave therapy and nerve stimulation, and then we treat a few other men's health conditions, one of which is Peyronie's disease. Now, we had a patient come in recently, and we've treated Peyronie's over time. It has varying levels of success. It's not as a consistent success rate as we see with like vascular erectile dysfunction, but we have had some really good outcomes with it. But the outcomes that haven't been so good are basically always based around people's expectations just being off, you know? Like, no medical intervention is 100%, but with Peyronie's, we really have to accept that if you've got, you know, a 90-degree curvature in the penis and you're expecting it to just be straight again, that's probably a little bit of an unrealistic expectation. So what I really work on with people now is making sure that the only patients that we take for Peyronie's treatment are ones who have a proper, realistic expectation of what treatment might be able to do for them, so that we're all aligned and that they're likely to get an outcome that they consider to be good. And a patient I had recently was just kind of perfect with this, and you know, it's always anonymous, obviously, but kind of shout them out anyway in this way, because he came in and he was like, you know what, he thought he had about a 45-degree curvature, has been diagnosed as Peyronie's, a recent bout of kind of sexual trauma with his partner. They both literally heard the click, and then as the weeks went on, he just started to notice that curvature kicking in. He had the pain in the acute phase, all the typical signs of it. And he went to the GP, and the GP got him a urology referral, and the urology referral really pissed him off and set him back, because it was just literally like, well, there's nothing you can do, live with it. To that degree of just like, meh, you know, we see this all the time, there's no options, bad luck, live with it. And he started to look around, and he came into my office to have a chat with me about what we could potentially do. Even after that, even after having that setback and feeling disappointed, he was just very practical. He was like, I know that this isn't going to look like how it was before, but if we could just improve it anything, X degree, then that would be good, right? It would make sex more comfortable, it would make that tense feeling going through it more comfortable for him, you know, less pain associated with it, and just aesthetically he would just be happier with it, because actually it creates a change in length. It's not just curvature, even just when it's flaccid, it actually reduces the length. So any improvement is going to be positive, and we just went into it with that frame of mind. The patient's been really good. He's stuck to the treatment plan, and he's adhered to the treatment that I've given him with a traction device as well. And within 4 appointments, he was saying it feels like it's softened the plaque, it feels less tight through there. And by appointment 5, he was saying there was a significant difference in that Peyronie's angle. Now, we're doing a course of 12 appointments, so we've still got a good way to go. But even within 5 appointments, to notice a significant difference and to notice less tension and have less discomfort through there is a really good starting point, because shockwave actually compounds with time. Okay, the more shockwave you do, the deeper you get into that course, the more effect you're actually having. Like I say to all my patients, it's like, it's a long-lasting effect as well. If people carry on with traction after the course of shockwave, then they can actually continue to make changes to that connective tissue for months after the treatment has ended. So be a little bit careful, guys. If you see YouTube videos of people saying this is going to fix it and this is going to do this and do that, it's like, we can treat Peyronie's, we can help with Peyronie's. It doesn't mean that everybody is going to get help, because there is no medical intervention which is 100%, but you do have to play your odds when it comes to healthcare. You've got to say, is this likely to make it worse? No, it's a safe treatment, it's non-invasive. Is it likely to make it better? To some degree, yes. Okay, the majority of patients that come through our door will see some kind of improvement for their Peyronie's, but is it going to fix it and solve it and like you never had it? Probably not. But that doesn't mean that it's a bad outcome, because if you make some improvement, even just a small amount, can actually make a big difference to how it feels to you, how that tension, tightness feels, how things look when they're flaccid, and how comfortable sex is. Right, well, I hope that helps. the patient that we're seeing is very local to us, but people come from all sorts of areas to get treatment with us. It's not unusual at all because not as many places do this kind of treatment, and not as many people like me are talking to you about the reality of the treatment in this way. So I don't know if this is resonating with you and you're like, yeah, I want to at least have a conversation and see if the way that we approach things might fit your specific condition, whether it's erectile dysfunction or Peyronie's or anything else. There is a link on our website to book a completely free and confidential call with me, and you can just talk it through with a professional, and we can see if it's something that we can help with. That is completely free. It's nice and easy to book. Get it done. We're in the South London, Surrey area, but yeah, we see people from all over because we do get really good outcomes with our patients.